Good afternoon. Today I will be presenting community organizing in the context of models of interpersonal health behaviors. This presentation will explore how community organizing works as a public health tool, its origins, key components, and how it fits within the theories of health behavior change. I'll also highlight real-world applications of the model in health interventions. Let's get started. Community organizing has a deep historical root in social movements, particularly in the early labor movements of the 20th century and the civil rights movement of the 1950s and 1960s. Leaders like Saul Alinsky, often considered the father of modern community organizing, and Miles Horton, founder of the Highlander Research and Education Center, played key roles in shaping this approach. Their work focused on empowering marginalized communities to advocate for their rights, whether that was fair wages, access to education, or health equity. At its core, community organizing is built on the philosophy of participatory democracy, the belief that those affected by societal issues should be directly involved in solving them. This idea fits well within the models of health behavior that emphasize the role of social influences and community engagement in driving health outcomes. Some key components of the model or theory are that community organizing can be distilled into four key areas: empowerment, participation, capacity building, and collective action. First, empowerment is central to community organizing. It's about providing individuals and groups with the tools and confidence to take control of their own health and well-being. For example, instead of simply telling a community what they need to do to improve their health, community organizers work alongside them to help identify and address these barriers they face. Participation is another critical element. Effective community organizing requires active involvement from the community. This means community members are not just passive recipients of information, but rather they engage in decision-making and leadership roles. Capacity building refers to strengthening the community's ability to address its own challenges. This could mean improving access to resources, enhancing leadership skills, or forming stronger community networks. Finally, collective action is the ultimate goal. Community organizing is about mobilizing individuals to work together towards a common cause, whether it's improving health outcomes or advocating for policy change. Measuring the impact of community organizing efforts can be tricky because it often involves both individual and community level changes. One of the most important constructs to measure is empowerment. This can be addressed by looking at whether individuals feel more in control of decisions that affect their health. Surveys that measure changes in self-efficacy or leadership roles can be useful here. Participation can be measured by tracking how engaged community members are in organizing activities. For example, we could look at the number of people attending meetings or how many community members take on leadership roles. To measure community capacity, we can use tools like community audits, which assess strengths and resources within a community, such as skills, partnerships, and organizational structures. Finally, we can evaluate health outcomes by looking at specific metrics like reductions in chronic disease rates, improvements in diet, or increased physical activity in communities where organizing efforts are focused. One of the greatest strengths of community organizing is its ability to engage individuals at the grassroots level. By involving the people directly affected by the problem, community organizing increases the likelihood of sustainable change. Another strength is its flexibility. The model can be applied to a wide range of health issues, from managing chronic diseases like diabetes to improving access to mental health services. Additionally, community organizing tends to lead to sustainable solutions. Because it focuses on building capacity within the community, the changes made through organizing are often long-lasting. Once a community has been mobilized, it can continue to advocate for itself long after initial intervention has been completed. Despite its many strengths, community organizing does have some notable weaknesses. First, it's resource intensive. Effective organizing requires significant time, money, and effort, both from community members and external facilitators. This can be a challenge in communities that are already resource poor. Another issue is the potential for uneven power dynamics. When outside facilitators come into a community, they may unintentionally undermine local leadership or impose their own agenda. This can lead to feelings of disempowerment rather than empowerment. Finally, there are evaluation changes. It can be difficult to measure the success of community organizing efforts because of the outcomes that are often long-term and multifaceted. Health improvements may take years to become apparent, and it can be hard to attribute them directly to community organizing. Now let's take a look at real-world examples of community organizing in action. One successful application of the model is in HIV/AIDS prevention programs, particularly in marginalized communities. In San Francisco, for instance, grassroots efforts led to the development of community-based interventions targeting at-risk populations. Through community organizing, healthcare providers were able to build trust with these populations, which led to increased testing, better access to prevention resources, and ultimately a reduced transmission rate of HIV. This example shows how community organizing can bridge the gap between the healthcare system and the communities they serve, especially when trust is an issue. Another great example is the use of community organizing to reduce childhood obesity in underserved urban neighborhoods. In this case, parents, teachers, and community leaders came together to advocate for healthier school lunches, better access to recreational spaces, and public health educational programs. These efforts led to a measurable improvement in children's physical activity and dietary habits. What's important to note here is that the success of the program was due to the collective effort of the community. By addressing the social determinants of health, such as access to healthy food and safe places to exercise, the community was able to create an environment that supports healthier behaviors. In conclusion, community organizing is a powerful tool for addressing public health issues, especially in underserved populations. By focusing on empowerment, participation, capacity building, and collective action, community organizing can lead to long-lasting changes in health behaviors and outcomes. Despite its challenges, such as resource demands and evaluation difficulties, the model's ability to engage people at the grassroots level and adapt to different health issues makes it an essential component of public health interventions. As we move forward in public health, integrating community organizing into our efforts can help build a more equitable communities for the long term. Here are the references for the studies and sources used throughout the presentation. Thank you.